Hi, my name is Sebastian Cotofana. I'm a professor of anatomy based in the United States, and the topic of this lecture is going to summarize the processes of aging that happens in the face. To do so, it is important to first understand what structures do we have in a face. I mean, what type of tissue do we have in a face? And the tissues that can be found in the face are actually starting from the bone. Then we have ligaments, then we have fat, we have fascias, we have muscles, and then of course we have the envelope, which is called the skin. So all of these structures that are present in the face, all of them can age. And there are some good and bad aspects about aging. The bad aspect about aging is this process is irreversible. You cannot stop it. It's irreversible, unstoppable, it's always ongoing and always continuing. The good thing about aging is we can modify how aging presents to us. In terms of, we know all of the saying, you look so much younger. But we don't say you are so much younger because we know the number has not changed. But the looks, this can change, and this is what we can influence. Independent with what type of aesthetic procedure we apply, this presentation of aging can be modified. But how do we tackle this? How do we change an aged facial appearance? The best way to do is, and I'm saying this as a scientist, is to understand what's going on. Because if we understand what's going on, we can address exactly those tissues and then modify their presentation and their contribution to aging. And what are those tissues? Well, again, bone, connective tissue, fascia, ligaments, fat, muscles, and skin. All of them are acting together as a unit. But here comes the tricky thing is, we need to understand that none of these structures age independently. They don't. They age together. Because when a bone changes, the overlying ligaments change because the ligament is attached to the bone. And when the ligament changes, the overlying soft tissue envelope changes because it changes its attachment to the bone. So all of this is acting together as an age-related unit. But to understand this, we need to decode who does what. And who does what, this is actually the major topic of this presentation. So let's start with the bone. The bone has different aspects in a face. And the bone also undergoes age-related changes. For instance, there's a part of our facial skeleton which is located high up here, which is called the calvaria. It's not a different planet, it's just this part of the facial skeleton. And this calvaria, it reduces in volume. So it means when we're younger, the volume is kind of pretty large. And when we're getting older, this volume reduces and reduces over time. In males, this volume reduction is 70 cc, so 70 cc, which is quite a lot. If you imagine this much volume needs to be restored to kind of recreate the volume, that's a pretty big thing, right? The other aspect that happens to the facial skeleton is the midfacial height reduces. So by midfacial height, that is the distance between the nasal spine and the nasal root, kind of this distance, it's the midfacial height. And that midfacial height over time becomes smaller and smaller and smaller. And the reason why this happens is because we have a clockwise rotation of the facial skeleton where all of these bony features in the face, they kind of rotate inwards, and this is why it reduces the respective anterior and craniocaudal extent of its projection. So if you take these two changes together, the calvarial volume loss and the midfacial height loss, it can be compared to a table, and on top of the table there is a tablecloth. Normally, the tablecloth fits the table. But what happens if the table suddenly starts to shrink? Then the overlying tablecloth looks in proportion too large. And because it's in proportion too large and doesn't have the underlying support anymore, because the table became smaller, the effects of gravity kick in and pull the tablecloth downwards. So it means suddenly there's more tablecloth touching the floor. But not because the tablecloth got longer by itself, It's because the table got smaller and smaller over time. And this is exactly what happens with the age-related changes of bones. The bones shrink in volume and the overlying soft tissue envelope reduces in its size. And the other aspect of bony changes, and you know this very well, is actually the alveolar processes of maxilla and mandible. They regress over time. And we know this very well. With this is associated also the teeth loss and all of these other aspects that go along with age-related changes. And if you look at this slide, even if I would have not written old and young, you would have known which is the old and which is the younger skull. So it's kind of, these are the changes of bones. So what about structures that are attached to the bone, like facial ligaments? So the facial ligaments actually have a very important feature because they connect the overlying soft tissue envelope to the underlying bone. When the bone changes, the ligament changes because there is less support for the respective ligaments or less attachment site. And if we translate this into angles, it could be that the ligaments, which at a young age emerge at a 90 degrees angle from the respective bone, at higher age they emerge kind of at a 45 degrees angle, because not the changes of the ligament itself, but because the changes of bone. And the ligaments by themselves, actually, there's no study today that has shown that ligaments truly undergo age-related changes. It's not shown yet. But there's evidence that ligaments are involved in the age-related process. And you can see that here very nicely. The ligaments, as they are arranged, they connect the overlying soft tissue envelope to the underlying bone. And all of these ligaments, when you take them together, independent how many ligaments you attribute that there exist, I always count with the most important 4, starting from the temple, going all the way down to the mandible. And these 4 ligaments are located in a line. We call this the line of ligaments. And this is a very important biomechanical separation line between the medial and the lateral face. The soft tissue envelope majorly contains fat. And this fat is arranged in layers. Those of you who know my lectures, you know that I'm always talking about layers and layers. But for the fat, this is especially very important because we have superficial fat and we have deep fat, right? And the fat, independent of superficial or deep, is arranged in compartments. And you can imagine that compartments, when we're young, they look like grapes, fully volumized. But when we're getting older, this volume disappears, and suddenly the grapes start to look like raisins. So we lose the volume because the fat goes somewhere else, like into the abdomen, into the liver, into the bone marrow. There are kind of a bunch of fat redistribution processes. But what does it truly mean for the face? For the face, it means that the layers and the thickness of the soft tissue envelope reduces. So it means what initially was, let's say, this thick at higher age becomes this thick, because we call this the fatty deflation theory. And this recent ultrasound-based study has investigated this, and you can find this soft tissue volume loss by and due to the fact of the fatty deflation theory also in the buccal region. You can see that here, independent of which BMI stratum you are, the fat will result in lesser soft tissue thickness. The same thing is applicable for here in the preported area, and the same thing is applicable for in this area where we have the neck. So all of these indicate that the fat redistributes and thus results in volume loss. What does it actually mean? For instance, this is a view from the lateral aspect looking into the soup, because more medially you can see the nose and cranially you can see the eye. It means that the fat provides support for the emerging ligaments. So it means the ligament originates from the bone, and between the ligaments and within the fat compartments, there you have fat. So when the fat kind of disappears, there is less stability. And when there's less stability, gravity kicks in and pulls everything downwards. And again, this in conjunct with the loss of bone volume, you can imagine why we have soft tissue descent. Everything kind of follows the effects of gravity. And now we're coming to another aspect which I think is pretty important, is facial muscles. Facial muscles in the past were kind of put together with skeletal muscles, but they're totally different. Skeletal muscles and facial muscle are totally different. They're histologically different, they act different, even embryologically they're totally different. Whereas skeletal muscles, they undergo a process that's called sarcopenia, which means muscle volume loss at higher age. For facial muscles, this was not really so far investigated. Is it true? No. There was a study which my research group recently performed with surface-derived electromyography. And we did this for all facial muscles. All facial muscles were investigated, and overall we found that there was no statistically significant difference in the muscle action potential when measured by electromyography between facial muscles of young individuals and old individuals. So it means the motor unit action potential, so the current that is produced by a muscle during its activity, was not different. That's, however, not overall true, because if you look at specific muscles, like the zygomaticus major muscle, we were able to identify that the signal, not the signal to noise ratio, the signal was statistically significantly reduced in zygomaticus major. We know the zygomaticus major muscle originates from the zygomatic arch here, inserts into the SMAS and travels to the modiolus. And along its pathway, it provides support for the SMAS and for all of the facial soft tissues to not descend. Now, if this muscle becomes weaker over time, it makes sense that soft tissues are more prone to descent. And this is actually what we see during facial aging. Everything moves downwards. We have increased nasolabial folds, marionette lines, and even jaws. Everything is increased because of the age-related changes that we find in the face. And now the last part that contributes to facial aging is, of course, the skin. You all experts, you know exactly what the skin does at higher age by losing its elasticity, increasing in firmness. All of this happens. And all of this happens because there is a word, of kind of a summary of factors, which is called the exposome. And this exposome influences a lot of age-related changes to the skin. Now, if you put all of these things together, all of them, you need to understand that every individual tissue that we have in the face, be it bone, ligament, fat, muscle, or skin, they age, but they age at a different pace, which means sometimes faster, sometimes slower. And this is totally different for individuals of different gender, different ethnic background. But to understand what really and truly contributes to facial aging, we need to decode what we see into the specific structures, and then to understand what is the key player in the aged facial appearance that we see. So in some extent, you need to play detective. You need to play detective and understand what contributes to the aged facial appearance. Once you understand that, then you can treat significantly better and more precise and individually adjusted for every patient. Because we know every patient is different, right? So this is why I think facial aging and the understanding, the why behind facial aging, is so crucial when it comes to this. So with this, I would like to thank you very much for your attention, and I'm gonna see you next time in person.